Yes, 9 o'clock, and as we come to you, you tune into Living, and every Saturday morning from 9 to 9:30, you're tuning in, we give you facts and fun. Basically, we spoke last week about biology, and today, we couldn't finish it last week, actually, and so today we're going to have biology part 2, and we're going to wrap up what we talked about when we spoke about stroke and heart attacks, and the most common cause of dying in the world today. So I'm going to come back and talk to you. Good morning to you. Good Saturday morning. Sit down and listen. Yeah, so biology part 2. You guys, you read Switch yet? The Miami Herald actually is taking that book, and they're going to give us a review. I think we got a bestseller, guys, but hey, you pick up that book. Go to any one of the pages across the nation and read Switch, and you could even go back and read 1.58 seconds. They're extremely good books, good read. We've been having some very good review, and Dr. Rambaran read that, and she had said it was extremely engaging. Dr. Alsop also want to shout out some people, those nice people in the as a matter of fact, the interns in Queen Elizabeth Hospital that's rotating through orthopedics. You guys are doing a lot of fixing of bones and screws in those bones. I want to say hi to you all. I know it's hard as interns. It's extremely difficult. You got to be around the clock. Yeah, remember those days? But guys, persevere, okay? And Zahira, I told you I'd shout you out today, and here you are. So, biology, let's recap a little bit about what we talked about last week. We talked about the heart, and we talked about it's a big hollow tube and sending the blood off to the arteries, and then the arteries take the blood to the arterioles, and then from the arteriole to the capillaries, where the nutrients and the oxygen and so forth from the blood is diffused into the tissues so that the tissues can live, thereby leaving with all of the debris and all of the toxic stuff that the body doesn't need, like carbon dioxide and so forth, to the venules and then to the veins and back to the right side of the heart. And you know, of course, from the right side of the heart, it goes to the lung, gets some oxygen, and then come back into the left side, and the whole process repeats itself. 5 liters of blood. Now you say to yourself, my goodness, this blood is using this blood all the time, but the body has ways of getting rid of some of the poisonous material and waste product. Kidneys and the liver. Those guys do a good job at cleaning things out. So some of the bad cells are removed by the spleen and so forth. We talk a little bit about that a little later. And the poisonous things we talked about removed by the kidney. That's why when people got kidney problems and liver problems and splenic problems, you find that they have problems with their blood. That's why. So we keep putting out new stuff, getting rid of the old stuff and so forth. Now, what are the plaques made of? You know, as you get older, we talked about the cholesterol and so forth. That's why what you eat and diet has such a profound effect on your longevity and so forth, because plaque formation from the lipids and the fat forms in the whole arterial network, from the heart to the peripheral arteries and so forth. So, as you get older, sometimes we talk about risk factors, and we talk a little bit about that also. And the more you have, give you the propensity for an increased or accelerated formation of plaques. The plaques are made up of sometimes calcium, cholesterol, and all that stuff. And we'll come back and tell you what happens to really cause the heart attack and the stroke and all those terrible things. And Elvis Presley, all shook up, and I'll be right back. Yeah, that's Elvis, all shook up. Now, you guys remember I told you about the registry, and I said that in 2009 we did a registry here in Barbados, and we followed people who would have had heart attack. We said it was a really astonishing number, and concerning, of course, 182 patients with heart attacks that presented to the Queen Elizabeth Hospital, and out of those, 50 were admitted, so it means 132 died before getting into the hospital. And out of the 50 that were admitted, 16 died. So you mean out of 182 patients with heart attack, only 34 we saved, which is around 20. That was 16%, somewhere around there, 16, 17%. That's kind of low. Normally it's 1/3 of the population, 33%. So we got some work to do, guys. So don't forget you have chest pains and you are of age, or you have risk factors consistent with cardiac problems, or you got a family history. Get to the doctor before 6 hours. We can give you the thrombolytics and save your day. Remember what happens? We'll tell you, but we talk about the plaque and how it happens. But basically, you get a heart attack, you get there before 6, we give you these thrombolytics, these blood thinners, or clot busters, as we'd call them, and it can save your muscle. Time is muscles. Time is everything. Same thing with a stroke, but the hours are shorter. The brain cells cannot stay for long periods without oxygen and nutrients. So 3 hours you have with a stroke. And remember what I told you about the stroke stuff. If you find that you have asymmetry of your face and your face is twisted, or you find that one of your even family members or your friends can't move, raise up one arm, you have speech problems trying to say one word and have problems getting it out. Stroke, entertain the thought, get there before 3 hours, and we can give you this thrombolytics and call the ambulance, and we can save you. I've seen patients who would have had a full-blown stroke, actually, taking the thrombolytics, and everything returned back to normal. So we need to do that. So, but we're talking about the plaques and the lipids and the calcium. It gets to 70%. When it becomes 70% or more, it becomes significant. It means that it's flow limited, meaning that enough blood is not getting to the organ, whether it's the kidney, whether it's the heart, whether it's the brain. All of those organs need those nutrients and oxygen, of course. So when it becomes more than 70%, it becomes very much significant. And sometimes it ruptures when it cracks. And sometimes what causes the cracking? Stress, some other disease that is different, some unrelated disease, the stress in the body in itself. And once the crack occurs, it exposes the inside of the plaque to the outside, to the blood, and then you start to have blood clotting factors released, and then you have this big blood clot forms there. Boom! You see, you block off that artery. It means that all of the muscle or the tissue distant to that artery dies. That's what the heart attack is. If it's the brain, it's the brain cells dies. Kidney, renal infarct, it means the kidney cells die. And that's the whole pathogenesis of the whole thing. So it has to do with risk factors. But I want to tell you, even before we go on there, let's think about this body. You ever thought about where your organs are? Some people think the prostate is in the neck and these type of things. I like to get it. If you know where your organs in this wonderful machine that you have, a lot of times when you have symptoms, you'll act quicker. Let's look at some of the risk factors that normally, what really happens? We colored folks, high blood pressures are a problem. So high pressure in itself in the arteries causes an instability of the endothelial cells, which is really on the inside of the arteries. So when it becomes rough, or a lot of friction happened, it means that things can attach, and that's how you find cholesterol, attaches itself to the inner lining. So it behooves us to really, as the Haynes trials 1, 2, and 3 shows, that if people keep their pressure normalized, even if it takes medicines, you can live as long as people who would have never had a blood pressure problem. So, watch your salt. Just cut back on the salt. We colored folks, we're extremely sensitive to salt. And you're surprised to see by cutting back on the salt, you don't even need medicines to keep your pressure controlled. Because it gets higher and higher and higher as you get older. So that's one way you could combat this risk factor. How about diabetes? I do not wish that, as I said, in anybody. It's a terrible, terrible systemic, non-communicable disease entity. That thing affects everybody, every part of you, all your organs, your eyes, your brain, you think about it, the kidneys, the heart, everywhere is affected. So stay away from sugar, guys. I've seen patients who are pre-diabetic, means that the sugar was going up, and I stopped them and all these, put them on a diet, stay away from all the fast, all the sweet drinks and all that stuff. And don't put sugar in your tea or your coffee or whatever you're drinking. Just chew natural stuff. Juice it, man. Get up in the morning and and just get a blender and blend some of that juice. Whether it's apple or I don't know which one of you like, it's just blend it together and drink that stuff. Be natural. Fruit. And stay close to the plant. And I'm telling you, it helps. It eases the pancreas. And you surprise a lot of those people go on their lives and you keep your weight down and they go back to non-diabetic status and they wouldn't need any type of medicines or so. Diabetes, it brings with it pressure problems, cholesterol problems, obesity, and all of that stuff. And who wants to be stuck with a needle every day, 2-3 times a day into the stomach, just insulin and all that stuff? That in itself has this morbidity. So, diabetes and high blood pressure and the cholesterol, you gotta stay away from the animal fat, guys. Plant product, you know what the fiber does? It pulls the cholesterol. I'll take a call, but I'm going to take a call in a second. Don't forget, I can take 2 calls today, 434-1771, 434-1790, 434-1791. And basically, you can call me and if you've got any questions about the biology that I've just taught you about the last couple of weeks. But you need to, fiber in itself will draw some of that cholesterol and stuff through your GI tract. So it keep close. Anything that is plant product, that will help you, and it'll increase your longevity. So, but the animal fat, you see that steak and red meat and all that stuff, I talk about it a lot, but because it increases the risk of so many things, cancer, heart disease, stroke and all that stuff. And obesity. Why do you think every time you turn the radio on, people would say to you, you'd see them exercising and so forth. You got to exercise. You got to do 20 minutes of brisk walking or riding or jumping or skipping 3 times a week. There's reason for that. It decreases your weight and decreases your risk of all of these things I mentioned before, hypertension, hyperlipidemia, diabetes, and all those things. And you ever, I don't know if you ever dissected the chicken that you eat. Have you ever seen a real fat one? We go for the fat one, we don't like the skinny one, right? And look at the organs, man. See what happens to the kidneys. Look at it. And the liver and all those things. Yeah. A lot of fat in it. How could that be good? You're stifling those organs. So, cut back, walk, climb the stairs, do all those nice things. I got a caller. Good morning.
Hi, good morning.
Morning.
I was calling to find out if the doctor traces sugar in your urine. Say, for instance, he takes you off of like these sweet drinks and stuff, and he tell you to use the Splenda. The Splenda is okay?
Splenda, stay away from it. If I for now, it might be something you want to tolerate, but all these synthetic stuff, this is stuff that messes with you, man. You just no sugar. Just stay away, brother. You find that within a couple of months, you won't even want to taste the sugar. Every now and then, you'll take a little bit. But yeah, Splenda and all those synthetic stuff, stay away from them, man. They got long-term effects in you.
Okay.
Thank you for calling, sir.
Okay.
I got another caller. Morning.
Good morning, sir.
Yes, good morning.
How are you?
Not bad. How can I be of service to you today?
Yeah, I got some pain in my 2 hands and I'm swell.
Okay.
And like my foot, like feeling weak and things like sometimes. And stiff.
Oh.
What could be that problem, sir?
Well, you have swelling in the hands and the feet and they're stiff, huh?
Yeah.
Well, you see, we were talking about the kidneys. Remember, I said that the kidneys in itself get rid of a lot of the water and all its toxin, and also the liver. So those are the first things I'll go for. I think that you should go to your primary doctor and get some simple blood tests. It can tell you what the kidneys and what the liver is doing, and also the heart is not a factor. But those are my 3 guys I would go for. You go in and your GP can tell you exactly what's going on. Some blood tests would give you your answer. Okay. Make sure you do that this week, please.
Okay, sir.
Good, thank you. And so we are talking about obesity and all these risk factors and smoking. I know that you guys listen. Please don't smoke. Please don't smoke. I had a short little program talking about marijuana and about smoking, and that's different. I'm not even going to take a call on that, but that's a different topic right there. And I think people are saying, oh, if you smoke marijuana, you would not get cancer and all these things, or heart disease and stroke that smokers normally. You know why? Because the smokers smoke more than you smoke marijuana. Smokers will smoke a pack a day, which is 20 cigarettes. Marijuana probably do 3 joints. It's because you're less exposed. But you see, the smoking itself predispose you to all of these things that I mentioned before. Yeah, I love the way you lie. You know, some people lie to you, and then sometimes they don't even know they're lying. They think it's the truth. If somebody's telling you something and they think it's the truth, it's really a lie. Crazy, isn't it? Pathology in itself. But, you know, all of that make the world go wrong. So, smoking, we talked about that. There's some factors you can't change. Age, gender, and your family history. Those you could try. You can't, they're non-modifiable. You can't change your age. You can't change your gender. They don't care if you want to perceive that. But, and the family history of sorts. So, but let's look at some of the organs. Let's go from the head coming down. It's good to know. The brain within the skull of itself. Come down onto the neck. If you just sit down there, right there, and touch these parts as I disclose them to you. Just under your neck where your Adam apple would be, just around that area, is your thyroid gland, or your parathyroid gland. That has to do with your metabolism, and it has to do with, you know, the rate of your cell turnover, and the calcium that's parathyroid, of course, deposits in your bone, removes, and so forth. You need that stability. Let's go downwards. Lung, you have a right lung and left lung, and then just above where the trachea comes from your nose, there's a tube called the trachea, and then you'll have the thymus and so forth, but leave that alone. You come in now, we're in the lung now, but from your mouth, you have the esophagus. There's a tube from the mouth to the stomach, and that tube is called the esophagus. It comes down and then expands into the stomach, which is on the left side. So if you put your hand right now, your heart is now just somewhere around on the left oblique area, around your nipples, okay? And just under the heart is the stomach. So you write this thing down, and it's good to know them. And now let's just on the left side, right? On the right side, but let's even go further. And then the spleen also is on the left side. So spleen right somewhere under there, all right? And then now you're coming on the right, move across to the right. You got the liver. Right under the lung there, you have the diaphragm, which expands up and down under your breathing. And then you have the liver on the right. So we're moving down. You know where your body parts are now, don't you? Kidneys. Shift your hands all the way to the back. 2 kidneys, one on the right, one on the left. So that back there, just behind there, let's say your abdomen is divided into 4 quadrants, upper and lower. Right upper, left lower, right lower. And just go wrong, just put your hands wrong, your kidneys are back there. And the pancreas is all the way there, somewhere near the stomach, going across a little bit to the other side, to the right side. So that's deep down. And then we go down. The legs are not hard. And then you have the gut, of course, in the center there, and it goes down to the anus. So that's your organ. You see how simple that was? I hope you wrote that down. So people, and your prostate now is just surrounding that urethra. Now, this is an important fact. The urethra, we urinate, males, to the urethra, coming through the penis. Females, you think that you urinate through your vagina. No, you do not. There is a urethra there, a small little opening that the urine comes through. Don't forget, it's not through your vagina now. It's through a small little opening called the urethra, just like the male. Got you on that, huh? Most you thought differently. So that's a little tidbit for you. So know where your organs are. If you know where your organs are and something happened, you know. I got a nice song here for you, Maroon 5, Misery. I'll play short a little bit because my time is coming. www.sparmanclaim.com. You can get on that site, you know, and you can, these programs are there. We place them there, so if you missed them today, you can get them. Don't forget tuning every Saturday, 9 to 9:30, and to Living. And this, I promise you, you follow what we say, you extend your life 20 to 30 years. I can't take any more callers, but I'm going to leave. This is Dr. Sparman, Dr. SparmanClinic.com, www.thesparmanclinic.com. And don't forget to get you switched, SWITCHED. Copy pages. I'll see you next week.
On Barbados. The boys on Barbados.